I'm just pretending to be a tree doctor. Hi, it's Cody Zhang, and I'm a licensed traditional Chinese medicine practitioner, and I'm also the owner of Body Option Clinic in Vancouver, BC. So today I'm going to talk to you about one unusual technique to relieve your chronic shoulder pain, and this is Acupuncture 104. Now, I'd like to talk to you about one of the most common complaint problem that I've seen in my practice is shoulder pain, particularly on the front of the shoulder or anterior shoulder pain. So out of the front, the middle, and the back of the shoulder, the front of the shoulder pain yield approximately 60 to 70% of my practice. For majority of the traumatic sports injuries or chronic and degenerative disease, shoulder pain is a very commonly seen problem that in our practice. And so I'd like to talk to you about what are some possibilities that cause the front shoulder pain. So let's look into the structure itself. So shoulder, it's formed by 3 different bones, and these bones are the clavicle or the collarbones, and the second bone is the humerus or the arm bones, and the last bone is the scapula. So the whole piece of the bony structure is scapula here, and between these 3 bones here we have 2 joints. One is called the AC joint, the well-known AC joint, or a acromioclavicular joint. It's the joint between the clavicle and the acromion. And the second joint is called the glenohumeral joint. So that's between this bone and this structure here called glenoid, or on the outside there's a labrum here, which you cannot see in this model, which is a piece of cartilage on the outside. So now we understand a bit of anatomy on the shoulder. And now let's look into what really going to entail within the shoulder structures. Let me show you on an app here. So on the front of the shoulder, we have deltoid, and on the underneath the deltoid we have biceps, long head and short head, and also part of the rotator cuff muscles. And also we have bursa, and lastly we have the pec. So that's only the muscle portion, but outside of that we also have nerve, which is the brachial plexus, and sometimes you see patients with shoulder pain that have nerve impingement. That's due to the nerve being pinched upstream, but have nothing to do with the shoulder itself. I like to go about one of the unusual technique to relieve shoulder pain. If you have already tried massage, physical therapy, chiropractic, acupuncture, pain medicine, maybe you've seen a specialist doctor or 2 and you fail to see result. And this might be why you're having this shoulder problem that have not been resolved. If you have already tried working on your rotator cuff muscles, rotator cuff tendon, or any tendonitis, and you have ruled out fractures, and you have ruled out possible any other secondary cause that's causing the shoulder pain, like for example, like gallbladder infection can also radiates to the shoulder. So to rule out those internal medicine disorders. So if you have tried everything else and you still fail to receive any good result, and this might be why you're having the shoulder pain. Now, as I explained earlier, we have a bundle of nerve called brachial plexus. 1, 2, 3. So these 3 are brachial plexus bundles. So those are big nerves from the neck. And you can see this nerve is running underneath this subclavius muscles and it innervate all the way down to the forearms, and it will keep extending down to the digits. Now, the problem is if you have nerve impingement somewhere in the neck, and all the symptoms will go downstream, meaning the shoulder in this case. So now I'm going to show you the relationship between the nerve and the muscle around it. So now you gain a better understanding why this technique will work. Now you can see that's the scalene muscle, anterior scalene, and the second one is the middle scalene muscle. Between these two muscles here, if you look at it from the side profile, the brachial plexus is like a sandwich between these two muscles. So what happens once you have developed chronic muscle tightness between these two muscles, or you have an injury like whiplash or something else like head trauma that caused the muscle to be dysfunctioned, and the dysfunction caused the muscle to be constantly contracting and causes impingement to the nerve, then no wonder you'll get shoulder pain as a result, but have nothing to do with the shoulder. Okay, now I'm going to show you the relationship between the muscle and the bone. So later on, that will explain why the technique and how the technique works. So remember I showed you from the anatomy app earlier, the middle scalene, it's inserted between this side, it's called a small tubercles on the lateral transfer processes on the cervical spines. So that's where the middle scalene inserted, and it's from C2 all the way to C7, and they all goes down to the first rib. They all attach to the first rib, which this is the first rib right here. Now, that being said, if you take a deep breath and your rib cage will be expanding, therefore the muscle and the rib cage will also be moving at the same time. So middle scalene has a function to support breathing. That particular technique will also be utilizing some breathing technique along with it. So I'm going to show you on a real human now. Like this.
Like that?
Resist. Resist. Okay, good. Hold it here. Push. Good. Push. Good. Now, hold, push. Good. Any pain?
Like right here.
All right, so now one more time. Push.
Ooh, like
Same,
right
huh?
here. Yeah.
Okay, so Marika does have some rotator cuff problems, but that's not our focus. The focus is shoulder. Now, we're going to get her to do this one more time. Make a fist. Resist. Any pain at all?
Right here.
Okay, push. All right, any pain at all?
Right here.
All right, good. So the upper trap got lit up. Could be the muscle is being facilitated due to some underlying injury, or it could be some behavioral patterns that she's been developed that she used the upper trap rather than the rotator cuff muscles. Now I'm gonna compare to the right side. Okay, make a fist, resist. Yeah, strong, no pain, huh? Mm-hmm. Okay, hold, resist. Yeah, so we got a reference point. The right side is normal, and the left side is resist. Yeah, a bit abnormal. Now turn one more time. Now resist. Now, so we're gonna get Marika. So let's get you come over. I'm gonna show you the scalene muscle that we have mentioned earlier. Resist. Now that's the SCM muscle. Okay. Now those are the scalene muscles that we're looking for. And then here, resist. So the scalene muscle are being activated. Now we're looking for the clavicle, and the first rib is underneath right here. Now we're gonna go find the middle scalene to perform a release. How are you gonna find a middle scalene? It will be a little bit tricky, but there's a quick tip you can use. Well, remember I mentioned the scalene is attached to the first rib. So the first rib is supporting the breathing, expansion and contraction. So that being said, taking a deep breath can trigger the scalene to be activated. So now I'm gonna show you a quick trick how to do it. Now we're gonna get Marika to take a quick sniff like this. Yeah, now you can see the activation of the middle scalene. Try one more time. There you go. Now this is halfway of the neck. So I'd like you to place your finger below halfway, about 1/4, the lower portion of the 1/4. I'm going to apply pressure to it. Now she will start to feel some numbness down to her arm. Right there. Do you feel that? Yeah, so that's where the brachial plexus nerve that I showed you earlier. And now we're just gonna hang in there. So the purpose here is to exhaust the muscle energy until the muscle is fully relaxed. So that can lead to the relief of the nerve impingement. We're gonna try one more time now. So remember, before the release, her arm will feel sore and with some pain as well. So we're gonna do the same test one more time to attest whether the pain has diminished. Okay, let's try it. Now make a fist, resist. Okay. Now resist. How's that feel?
It feels better this way. I can still feel like a little bit here, but
when you're doing this, right?
yeah.
So try one more time. So you can see some facilitation here because once she's resisting, you can see her trapezius is lifting up. So I know that some muscles here is not activated. So now I'm gonna try the same maneuver while she's sitting. So now what I would do, because we just released the lower 1/4, now we're gonna go up to the second quarter. Second quarter here, so this one will feel a little bit more sensitive. Now just release it. Yeah, it's a beautiful thing. Yeah. Okay, good. Okay, now we're gonna try one more time. Make a fist, resist. Yeah, that's sturdy. No pain though, right?
No.
Okay, hold, push. Okay, now before I ask her, I can see that she's activating the biceps rather than her trap. Let's try one more time. Any pain at all?
No.
Yeah, so that indicated her shoulder pain possibly have nothing to do with the shoulder itself, but with possibly just the nerve being impinged as a result. Lastly, I'm going to show you how you can do it by yourself at home or anywhere. First thing is to identify your own SCM muscle first. So you can identify that muscle by just turning your neck to the side. Let's say if you wanted to release the scalene on the right side, and then you turn your head to the left. So now you find this prominent muscle here. That's this SCM muscle. So now you brush your finger posteriorly onto the back of this SCM muscle. Now we're onto anterior scalene, middle scalene, and the posterior scalene. Now my goal is to alleviate the anterior and middle scalene. How are you going to do it by yourself? Now, so you put 1 or 2 digits onto, so remember, so you draw a middle line here from your Adam's apple, and it will be slightly below, about 1 finger breadth below. So that will be your target here. And then you'll find 1 or 2 trigger points here that you'll feel really tender. And if you hit it right, you should feel some radiating, a mild numbing sensation traveling down to my shoulder. So where I can feel it right now. And so once you get to that point, it'll be good to do some neck tilting, left and right until you feel the sensation deepens. And now I'm feeling it down to my elbow, and you can just get it. You can go a little bit hyperflexion like this, and same goes to this way. And if you have other tools like a lacrosse ball or any other tools, you can also do grasping on it, on this muscle, to alleviate tensions, to release the nerve impingement. So that's how you treat the chronic shoulder pain. If you have tried stretches, massage, physical therapy, chiropractic, or anything under the sun and it failed to work, give this one a try. And I'll see you next time. And also don't forget, like and subscribe.